On February 5, 2013, the New York City Council passed Resolution 982A, urging President Obama and the U.S. Congress to increase funding for stroke prevention and treatment research. The resolution was introduced and authored by Councilmember Mathieu Eugene of the 40th District. Councilmember Eugene organized a press conference in the morning before the successful vote was taken on Resolution 982A. According to the United States Center for Disease Control and Prevention, stroke is the fourth leading cause of death in the country. It accounts for over 100,000 deaths annually and costs the U.S. more than $50 billion a year. The council member sees this resolution as a way to help reduce these gaudy statistics.
Good morning.
My name is Mathieu Eugene, and I'm the New York City Council member representing District 40 in Brooklyn. Today we are going to talk about Resolution 982, which is a wonderful, very important resolution. First and foremost, let me thank all of you for joining us this morning. This resolution, meaning Resolution 982, will address a critical health issue facing our community by requesting an increase of funding for research and treatment. This will lead to the development and implementation of better health solutions. As we know, stroke is a serious life-threatening condition that affects over 750,000 people nationwide each year and is often fatal. In purely monetary terms, stroke costs our nation approximately $50 billion. Stroke is the fourth leading cause of death in the United States, and although not always fatal, can often result in severe conditions such as paralysis, emotional trauma, and disability. Survivors of stroke face many difficulties recovering and living functional, productive life. A person who has suffered from a stroke can require a lot of pain and medical attention throughout the day. Stroke not only affects that one person, but the families and the friends who must often step in to care for that person. This puts a lot of pressure on the family members and changes in their life. They are not circumstances any one of us would want to live in, and we should do all that we can to make sure as few people as possible have to. Through awareness and better funded programs, we can lower the risk and work out to prevent the onset of stroke. By focusing on prevention throughout a positive lifestyle, we can significantly reduce the number of people who suffer from stroke. Over the last few decades, there has been a substantial reduction in the number of people dying from stroke. Funding on research from the National Institute of Health played an important role in this reduction. However, we need to make sure that leaders at the federal government devote more resources toward stroke prevention and research. As the saying goes, 1 ounce of prevention is worth a pound of cure. As a medical doctor myself, I have a unique perspective in such matters and was delighted to draft a resolution supporting this goal, calling upon the United States Congress and the President Obama to increase funding for research on stroke prevention and treatment. Funding from the federal level can have an immense impact on the local level and help communities such as this great city we call home. More research can lead to new medication, new form of care, and new method of helping survivors of stroke, and just as simply their family. Let me take the opportunity also to thank the wonderful doctors who are here today. Take time from their busy schedule to come to support this movement. And I want to thank you also for the wonderful job that you have been doing, saving people's lives, helping people who have been suffering from stroke, and also helping the family. Just imagine when you give somebody his life or his health back, you are putting together in the entire family. Because when somebody is suffering from stroke, you know that the family goes through so many struggles and pain to do everything possible to take care of this stroke patient. And I think that in your daily life, you give fathers to children, mothers to children, put the family together. And I thank you so much for being here. And I thank you for what you have been doing to keep our community safe, healthy, and also to make sure that the people can have more days, beautiful days, by giving them the right treatment. And we are here together today. This is not the last time we're going to continue to work together. And probably we will have a day of awareness for the entire city, where all the doctors, all the hospitals, the clinic, all the medical professionals, we can go on the street, we can go in the houses, we can go on TV, everywhere to let the people know that stroke is a serious disease. And this way, we will be probably able to protect so many lives and also keep a great city, the city of New York, healthier. Now, I'm going to call the first speaker. And those doctors, as I said, they are wonderful doctors. And I thank you also for your participation in the committee that we have. Let me call Dr. Stephen Rudolph, who is the Director of Stroke Medicine at Maimonides Medical Center.
My stroke, I spent my childhood in and out of hospitals dealing with speech, occupational, and physical and reconstructive therapy and surgery. Also, I could learn to walk and talk and write again. While all that remains today is a residual paralysis on my right side, I'm an active and energetic public relations professional who enjoys traveling around the world and sharing my story with everyone I meet. I'm here to support Resolution 982, and I thank Councilmember Mathieu Eugene for his championship of this cause. Thanks to stroke research, I've had access to necessary surgery and therapies that not only saved my life, but enriched it by allowing me to be fully independent. Also, it's very important that we know more about the signs of stroke and symptoms than we ever have before. Speaking of, I hope we know what those are. Do we? Fast. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call 911. And thanks to the New York City Council and Councilmember Eugene, I look forward to a day when stroke research is expanded even further and no other child will have to spend their days in rehab and everyone can lead a stroke-free life.
Now you are going to hear from Dr. Susanna Alva, New York Presbyterian Hospital, Columbia University Medical Center.
Thank you. I too would like to thank Councilman Eugene for putting forth this bill because stroke research is vital and it really is underfunded, and with the cutbacks now at the NIH, it's more and more important that we remain firm in our commitment to stroke research. It's people like Jen Butler who inspire us as physicians to try to reach the next level and get to the next step and know a little bit more about stroke and its mechanisms and what to do to help people so that this is something that becomes, it's now gone from the third to the fourth leading cause of death in this country, and we want to see it go further down the list, and that can only be done with meaningful research. Thank you.
Now it is my pleasure to introduce Dr. Salman Azhar, Lunan Medical Center.
Thank you, Councilman Eugene, for a great bill. Stroke research has been so instrumental in getting us to this point. We know that the first few minutes of a stroke is so crucial. To get into a hospital, we can do something about it. But how do we get that message to our different and diverse members of New York, communities of New York? How do we actually, once they've had a stroke, get them better? This is so important, and the need for more research dollars, and that's why this bill is so crucial, because if we can get the research dollars now, the difference that we can make in our grandmothers, in our fathers, in our mothers, and our brothers and sisters And in our children, it's going to be dramatic. We're going to give people a quality of life that is so important, and the ability, as I always say, to continue to use the subway systems of New York and do all the things that you want to do, because you're able to walk and talk, and because we've been able to save you from having a stroke. So this research in Councilmember Eugene is very, very important. And I really think the idea of a stroke awareness day is very important. By doing these things, we can make a real dramatic change in our communities' lives. And that's what this bill is about. Thank you.
Thank you very much, Doug. Now it is my pleasure to call Robin Vital, Senior Director of Government Regulation with the American Stroke Association.
Thank you so much. Again, my name is Robin Vitale, and I serve as a staff representative of the American Stroke Association. And allow me to share my gratitude to Councilmember Eugene and indeed all of our champions on this issue on the Council Committee on Health for pursuing and supporting Resolution 982. This resolution is pivotally important for the American Stroke Association. Currently, the NIH devotes just 1% of its overall budget to support grant research opportunities to promote stroke therapies. That is woefully small in our opinion. The American Stroke Association is advocating for an increase to the overall fiscal year budget for 2013 to $32 billion. And today we hope that that percentage will increase from 1% to where it needs to be, significantly higher. Obviously, this is something that there are tremendous costs to our society. The direct cause of stroke we expect will escalate by 238% between 2010 and 2030. Prevalence of stroke is expected to increase by 25% over this time. Not only is this a cost to our society, but obviously we know that stroke is something that is so prevalent and so destructive that it needs to be corrected so that those that are victimized can go on to live productive lives. And it's not only about the healthcare costs, but it's also about the economic impact. We know that the NIH grants really, they produce over millions of dollars of economic job-inducing benefit. For every dollar that we invest in NIH, we receive a return on investment of $2.62. That's a good investment. I think anyone who's looking at the current state of our economy would agree with us. So thanks to this resolution, we look forward to congressional action on this, and we look forward to a time, to echo Jen Butler's words, that we have a stroke-free society. Thank you.
Thank you very much. One more time to each one of you. Thank you for what you have done, and thank you for your support. And we all know, by investing more money for research and treatment, we are going to improve the quality of life of citizens of the United States. Mothers, fathers, children, workers, people who work very hard to make this country the best country in the world, the wonderful country it is. But I think it is the moral responsibility of the government, of the leaders, to do everything that they can, to do everything that we can to invest in research and treatment in order for us to improve the quality of life. This is our job and our responsibility. And also from a selfish point of view, it is good for the government also. Because when people are working, they are paying taxes. They are bringing income to the government. And that allows the government to provide services to everybody. But when somebody is suffering from stroke, that person cannot work, cannot sustain his family, and cannot pay taxes also. And what will happen? The government will have the responsibility now to take care of that person, to take care of his family members. And I think this is the wise thing to do. This is the right thing to do. And that's the reason from the bottom of my heart. Again, thank you very much. And I think this is the beginning of a long-term partnership. Thank you.
Thank you.
God bless you all. Thank you very much.